him, but he cannot be here today, so I'm doing the job. So David Lansky is the President and CEO of the Pacific Business Group on Health. Since 2008, David has led the coalition of 50 large employers and healthcare purchasers representing over 3 million Californians, including CalPERS, Wells Fargo, Intel, Safeway, Chevron, and University of California. A nationally recognized expert in accountability, quality measurement, and healthcare IT, David has served as a board member or advisor to numerous healthcare programs, including the National Quality Forum, National Priorities Partnership, the National Patient Safety Foundation, the Leapfrog Group, the Medicare Beneficiary Education Advisory Panel, Cal eConnect, and American Health Information Community. He is now the purchaser representative on the Federal HIT Policy Committee. David holds a PhD degree from University of California, Berkeley. Let's welcome David Lansky.
Good evening, everyone. Thank you so much for letting me come and join you. I'm really excited to be in a group of people so creative, energetic, innovative, because a lot of where I spend my time is not that way. So I'm glad to have a chance to hear from you and talk with you. I wasn't quite sure what the right focus would be for what I should share with you tonight, so I put together the usual sort of presentation. And as you see here, it's a little bit of a David Downer. It's kind of why are the purchasers so skeptical about a lot of the work that you do, and why is it so hard to get uptake for innovative solutions to healthcare challenges from the people who have the money and the lives and the influence in the healthcare system, like the companies Pranay just described. So I will do some of that, but I would also encourage you to interrupt me and take us off course and talk about other things. We could talk about the Supreme Court, and we could talk about health IT, which I didn't do much in this presentation, but it is, as Pranay said, where I spend most of my time. And I wasn't sure how many of you were wedded to the health IT strategy, but I'm happy to get into that discussion if that's of interest. So let me thank particularly Pranay for inviting me, and Jerry Hinckley and the Pillsbury folks for hosting this event. So purchaser perspective. So I thought I'd better start with sort of getting you oriented to the world I live in. This is an association of really big companies, and they employ many, many hundreds of thousands of people. And they provide healthcare coverage and benefits to all these people. And so what they have my organization do is essentially represent their common interest in affordable, high quality, predictable healthcare. And especially as you all understand, the last few years, affordable is the buzzword of greatest concern to them. And I'll talk some more about that in a minute. But here you see a lot of big name brands. A lot of these have a big California footprint, but most are national and even global companies. I just zoomed in here on this one group you may know, the Silicon Valley Employers Forum, which is in turn made up of all these companies, obviously many of them involved in technology and innovation and IT in particular. So all these companies are who I try to listen to and respond to when they think about what they want from healthcare. Not as a product that they're themselves developing, but on behalf of their workforce and their family members. So I thought I'd better ground you in sort of this ecosystem that I live in. And it's a really simple picture, but the basic idea is down there at the bottom are the providers, doctors, hospitals, clinics, nurses, that all of us mostly contact to get our healthcare services from. They are in turn getting their money and their access to patients from health plans in the commercial space, leaving aside the over 65 Medicare population. And then over in the upper right are the secondary purchasers, which is my world. These are the large employers, like my members, but also the big government buyers of healthcare, like Medicaid and CMS, Medicare, and other programs in the federal government in particular that buy a lot of healthcare. And then over in the far left is the patient, the primary purchaser, who ultimately it's their money, and increasingly it's directly their money, that's going to pay for everything else. And the reason I put this up was just to sort of both tell you where I sit on this picture, which is this upper right-hand corner, and you notice that we are mediated by the health plan. Most employers don't directly communicate with providers about their healthcare solutions or about the technologies they will invest in and buy to support the patient. The health plan is the direct channel, and that's a very important part of the dynamic for where my community lives. So I thought I'd put you guys on here and say, to my observation, you are going to have, your customers are more likely to be in the provider community, and you're directly providing services to them and selling to them, and some to the health plan community, if you're involved in data mining, data management, a lot of the ancillary services around health plan functioning. And I'm sure a number of you are talking directly to the patient. and trying to sell directly to the patient and make tools available directly to the patient. But very few of you, I would guess, are talking to my folks, my member companies. And so it's a problem. Because actually, I think in my community, you would find the greatest interest in the innovative solutions that can come out of the work you're all doing, but we are disintermediated by the structure of the healthcare system. And this will come up over and over again. Just to refresh you, if you're not paying close attention to trends in healthcare, I'll try to give you a 3-minute snapshot of the things that are on the minds of the big companies, the big employers in California and generally. First of all, this is kind of a stunning slide. This is the heading, if you can't read it, says, employers' confidence that healthcare benefits will be offered in their organization a decade from now. So 10 years from now, will your company, Chevron, Safeway, whoever, be offering your employees good healthcare coverage? 23% think they will be 10 years from now. And look at the trend line on that picture. That's an unbelievable falling off. So to the extent you all assume, either because you're employed by one of these companies or you're selling to the marketplace which is supported by their dollars, this is not a sustainable expectation.
Are they assuming that the individual patient is going to be picking up the majority of that cost relative to the company having to pay for that?
Yeah, or the government. So there's a trend right now of shifting more cost to the patient, the employee, and their family. But ultimately, you could imagine the exchanges or some direct single-payer model simply displacing the employer as the source of coverage. Yeah.
I was going to ask that in transition to the ruling today. The trend is directly correlated almost to the individual mandate exchanges and fear that people are going to become larger plans and become people on the exchange.
Yeah.
So from your perch, I would imagine you have a lot of insight to what people are actually thinking.
Yeah, well, we spent a lot of time talking about it. Most of these companies are sort of the good guys. They have rich benefits. They provide good coverage. They're affluent companies. But they are themselves, on this graph somewhere. I think most of the people on this graph who are in the 23% are companies like mine, because you expect, the Chevrons and Intels of the world will be around with good coverage for a long time. But the smaller employers just can't afford it, and they aren't expecting to be involved that long.
Just the timing, can you attribute any percentage of the declining curve of confidence towards future services having its peak in 2007 is being correlated with the 2008 market shock? I mean, it seems like that would be it.
And I think if you take that market shock coupled with healthcare costs going like this,
You're cross-cutting.
you just can't do it. Let me keep going through this, and we'll come back to more conversations. This was just my opening.
There will be 15 minutes at the end for questions.
Our biggest challenge is maintaining affordable coverage. So this is why they think they can't stay in the game. And I just circled the ones that may pertain to your business strategies, which is specialty drugs, appropriateness of care, new medical technologies, too many services. So the utilization of expensive technology, broadly construed, is half of the things they're worried about, the employers are worried about, driving up costs. So there's a sort of a dampening force coming from this conversation on the energy to introduce new products and technologies. And we'll, of course, talk more about that. On the public side, government sponsorship, not the employer sponsorship, you all seen that this is already, and we come back to the deficit reduction game in the next 6 months, how we're going to save money for the federal government to have a sustainable federal budget. This is what Obama has already said is on the table. Now last fall, he said $320 billion in cuts in 10 years. This number will be much bigger in reality. So we're talking about trying to save $1 trillion over 10 years out of healthcare. So again, the opportunity, the appetite for adopting new technologies, especially expensive technologies that are not cost offsetting, is really going to be diminished as these pressures continue to grow. If you haven't seen it, this is how out of whack we are in our spending with the rest of the world. This is the American per capita healthcare spending compared to everybody else. This is that we're not getting better health for it. You probably can't see in the back, but the United States is spending by far the most, but we're just in the middle of the pack on longevity and morbidity and so on. Undisciplined use of new technology, I'll say. These are the top bars, how often we do heart revascularization procedures compared to the rest of the world, about double anybody else. The second one is the MRI adoption rate in the United States, also much higher than most other countries except Japan. So again, the employers look at this stuff and say, gee, I've got employees in South Korea and France and Italy and Egypt, and they aren't using all this technology and they're fine. Why am I spending so much money for so much technology in this part of my workforce? And they don't have good answers. One more piece of this, which is this third-party payment we all talk a little bit about, that the consumer doesn't directly pay for things. Maybe that creates a distortion. This is just kind of interesting, the data originally from Safeway, you see at the bottom. Safeway went around just in the Bay Area, and they're self-insured, they're paying the bills for the healthcare that their employees use. So you're a Safeway, you're a checker or a manager at a Safeway, and you go out and you say you're 50, it's time for your colonoscopy. What you do typically is you say, oh, where do I go? My doctor recommends this place around the corner, and I go there and I get my colonoscopy and I pay my copay, and I'm done. Safeway gets the bill for the rest, right? So the bill they get ranges from about $500 for a plain colonoscopy at a place over there on the far left of my picture to $8,650 if you go to Pleasanton Surgery Center.
Wow.
So when the employee is simply, I don't know, they said go to Pleasanton Surgery Center, that's where I went. It was fine, and I got a good result. But my employer spent $8,000 for the $500 test. Because this lack of transparency this is just real objective empirical data happening to employees at the Safeway you go to today in San Francisco. So Safeway looks at this stuff and says, this is nuts. Why are we paying for any of these places over here? Why don't we somehow direct our employees to go to this part of the picture? Unless there's some quality difference that's significant, why wouldn't you tell people, please go to the more affordable places? So this is, again, just sort of the context of where the employer is looking at their data and saying, what are we doing here? Lastly, lack of technology assessment. Yeah.
I have a question for you. You mentioned the data. From where is this data accumulated?
This is from the bills Safeway pays directly. They pay their own claims. So this is actually the check they are writing to these places.
So nationwide, are the averages that are pretty much predictable factors that could be?
Yeah, I would say everybody who does research in this space would say there's an 8-fold variation for almost anything you identify. In fact, I can show you the data for total hip replacement and knee replacement in California. The range is from 15,000 to 110,000.
Where is that accessible?
Oh, it's not. It takes, Safeway has to get the data and do their own data mining to get the answer. There's no publicly available data like this. So it's a huge issue for big employers. And actually, if you're looking for business opportunities, this sort of data mining and transparency, there are a number of startups. Castlight, many of you know, is a local company that just got a big infusion of cash. Castlight is doing a lot of this kind of work for their employers here. Yeah.
So how are the health plan tracking that information? How are they paying the?
It's a really complicated business question. The health plans are negotiating prices between, say, Anthem or Blue Shield or Aetna is negotiating with every one of these for the best price they can get, which is a market forces business dynamic. And they consider that proprietary. Each of them thinks they got the best deal. They don't want the other guy to know what deal they got. So there's this, it's a very complicated, I think it's a distraction for tonight, but the underlying economics here are really ugly.
Just
It seems fairly obvious to people in the medical and psychological community that prevention and health promotion is the best way to save money. Why is it so difficult to get the system behind that? When everyone who's in a position to recommend it and understands what's going on says, we need prevention, we need health promotion, we need lifestyle modification.
I would say that all the companies I showed you earlier are very serious about that, and they do a lot of work around identifying health risks and health needs and helping people get tracked into stop smoking programs and obesity programs and all that stuff. At the same time, they're paying these enormous bills. The money is flowing out the door. So they're in this, on one hand they believe in it and they're investing in it and they're doing pedometers and all kinds of things to get people into self-care and self-management. And so there is a business there. I was glad to hear about the company starting the wellness programming here. That's a good opportunity, but the CFO at these companies is writing checks in the billions of dollars for this stuff, and both are going on at once. Let me keep going through this and get to the goods for this. So this is just a New York Times editorial a few months ago. This is about proton beam treatment, and the headline is the main thing I wanted you all to be paying attention to. There's not an expectation anymore that new, expensive, snazzy technology is necessarily beneficial. And in particular, as this series of articles points out, they tend to be very beneficial for a small number of patients, but then applied to thousands and thousands of patients who may not get a net benefit. So the appropriateness of patient selection and treatment has become a really big deal. So my organization, Pacific Business Group on Health, we have a vision. So I'll share that with you, which is transparency about quality, cost, and outcomes, kind of things we just talked about, where both consumers are motivated to look for, like we saw in the Safeway drawing, the more cost-effective providers, and providers, physicians in particular, are incentivized to offer better quality, more affordable care. That's what we try to do. The kinds of things the employers I work with are talking about now Cost is going up, quality of care is variable and not transparent. Those two are not related to each other. What they pay has nothing to do with the quality of what they get as an employer on behalf of the employee. A variety of tools that have been around for years, those of you who work in healthcare are familiar with these acronyms, aren't having much impact, even though we've all worked hard to do this stuff. Expecting that the health insurance companies, the health plans will fix all these problems, which is where most employers were for the last 20 years, they don't believe that anymore. They're very skeptical about the health plans as partners in making a difference in quality or cost. Managed care was kind of the aspiration of the 90s. That's very little interest left by the large employers in managed care. A lot of frustration, frankly, with the delivery systems and the health plans of not trying very hard anymore. They are really kind of complacent. They've learned how to maximize their income in the current model, and they're not very enthusiastic about disrupting the current model. And they're not seeking efficiencies or improving quality as aggressively as we think they should. And again, you look at the companies on my list, they wake up every single morning desperate to innovate and improve and compete. And they don't see that same energy level coming from the healthcare system. Yeah.
Do you see many companies moving to a plan design like C-chain? C-chain, when the consumer takes the assessment or whatever wellness activities, then suddenly deductible goes down. And I'm wondering if they are finding that kind of plan design is more effective to change this dynamics.
So if you can, everybody hear, the question was whether it's some companies which are moving toward a much more consumerism model, where consumers have more, they say, skin in the game. And there's a lot of emphasis on people making wise choices, if that's being effective. And I think the answer right now is so-so. About 10% of people are in those kind of plans right now. And they are costing less, and they're using less healthcare, but they are actually skipping a fair amount of needed healthcare. So we're waiting, there's maybe a little balloon of additional care that's going to come down the road. So I think right now most companies are still going down that model, but cautiously, I would say. Cost savings innovation, which is really the theme of tonight, we're not seeing a lot of it. We're not